All right, we are wrapping up the integumentary system, talking about some different things that could possibly go wrong with this system. So, starting off with some diseases, the biggest one is going to be cancer of some kind. And we have three main types: basal cell carcinoma, squamous cell carcinoma, and melanoma. And so the names of these different types of cancer can indicate which cells are being affected. So a basal cell carcinoma is going to be cancer that's affecting those basal cells in the deeper layers of that epidermis. Squamous cell carcinoma is cancer affecting the keratinocytes of that stratum spinosum layer. This type of cancer commonly is discovered on the scalp, ears, and hands. And then melanoma is a cancer that is the uncontrolled growth of melanocytes, which are those pigment-producing cells. Cancer we'll talk more about in later chapters, but it is uncontrolled growth and division of these abnormal mutated cells, and they are not getting a signal to stop dividing, stop going through mitosis, so they're just going to keep creating more copies of themselves over and over and over again and never get that signal to stop. And so most cancers are identified by the original cell type that they start in. Skin Cancer Foundation is estimating that about 1 in 5 Americans will have some type of skin cancer in their lifetime. This is due to a variety of factors, but the core cause is exposure to UV radiation, especially overexposure to that UV radiation, because ultraviolet light, UV light, is going to damage DNA, which can lead to these mutations in the parts of the cell cycle that are checking to make sure everything's okay. They're going to impact those checkpoints in that cell cycle and allow them to undergo that mitosis process repeatedly over and over and over again. Melanin does offer some protection against that DNA damage, but it's not always enough protection. People with lighter skin colors are more prone to cancers, but people with darker skin tones are still at risk for different types of cancer, and so they should still be taking those same precautions that anybody else would be taking. There are skin cancers that can occur on areas of the body that are not generally exposed to UV radiation, so there are probably other factors at play in addition to that UV exposure, but that UV radiation exposure is really that big underlying factor. So basal cell carcinomas are going to be cancers that, again, affect those stem cells deep down in that basal layer of the epidermis, and so this is what a basal cell carcinoma looks like. This picture isn't too terribly bad, but it is the most common type of all cancers that occur in the United States, frequently found on head, neck, arms, and back, because those are the areas that are most likely to be exposed to that UV radiation. There are other radiation and toxins that can cause this type of cancer, but UV light is the most open. Interestingly, wounds on the skin from open sores, tattoos, burns can also increase the risk of developing this type of cancer. So these are going to start in that stratum basale layer and usually spread along that boundary, and then at some point they'll start to grow towards the surface and become this kind of uneven patch, bumpy patch growth, or some sort of scar-looking structure on the skin surface. Like any other cancer, this is going to respond to treatment best when it's caught very, very early, which is why you should always be checking your skin and paying attention to anything that seems a little bit strange. That doesn't mean you should panic immediately, but keep an eye on it, see if it keeps changing in appearance pretty rapidly, and if it does, then you should definitely go get that checked out. The most common treatment options are surgically removing this, so they will go cut out pretty deep into the skin to make sure that they get all of those cells that are in that deep basal layer. Freezing or cryosurgery can be another option for treating this, as well as topical ointments. The next type is squamous cell carcinoma. The image for this one is quite a bit more graphic than the previous one, which is why I have this warning on here, so prepare yourself. But squamous cell carcinoma is a bit more invasive. Again, this is a cancer affecting the keratinocytes of that stratum spinosum layer. This is usually going to be found on the scalp, ears, and hands, and is the second most common type of skin cancer in the United States. About 2 out of every 10 skin cancers are squamous cell carcinomas, and it is far more aggressive than basal cell carcinomas. So if these cancerous lesions from squamous cell carcinomas are not removed, they can metastasize, which means that those cells can actually leave the epidermis and spread to other areas of the body and start producing cancerous growths there. Surgery and radiation are the most common things to cure this type of cancer. So surgery is going to be very similar, where they're going to go in and try to cut out as much of this tissue as they possibly can, but there is usually going to be a lot of scans involved to make sure it has not metastasized already, because that dramatically changes the treatment plan. Last but not least are melanomas, the least graphic looking of the 3 types we're talking about here. Again, melanomas are cancer that is uncontrolled growth of melanocytes, those pigment producing cells. This is usually going to start out where people have a mole that is already existing. This is the most fatal of all types of skin cancers. It's highly likely to metastasize and spread to other areas of the body quite quickly, and because it's starting out in an existing mole, it can be really, really hard to detect early on, because it kind of blends into that mole initially until it gets quite a bit more advanced. So you do always want to be checking any moles that you possibly have, and you want to be familiar with their appearance so that you can kind of monitor those changes. You know, this is not something that you need to be looking at every single day, but about once or twice a year, you should kind of do a quick check. If you've got some in areas of your body that are not easily visible to you, have somebody else help you out with that. Make an appointment with your doctor. They can check that for you. They would be more than happy to do that for you. But keep an eye on those moles just to be safe. So this is a very, very dangerous type of skin cancer. Usually they're going to appear as this kind of asymmetrical brown and or black patch that we see here. So most moles are going to be pretty even in appearance. So you probably are checking moles on your body right now. They tend to be pretty flat. They tend to be very evenly colored across that entire mole, and then they're not going to have these really, really, really super rough edges that we're seeing here. They're not perfect circles, but they're not going to have these super rough, uneven edges. So once they turn cancerous, they can have these really, really uneven borders and can get very, very raised. There are moles that can be quite a bit raised, but a lot of them tend to be very, very flat. Treatment for this type of cancer is going to be surgical excision, so cutting this out just like the previous 2, and some immunotherapy treatments, so kind of getting your immune system to help out with fighting this cancer. But again, treatment needs to be done as early as possible, because this is that one that is going to metastasize very, very quickly and easily, and that changes the treatment plan, because once those cells are in other areas of the body, you're more likely to need radiation therapy or chemotherapy or something like that, if not more invasive surgeries than just cutting a chunk out of the skin. So there is a mnemonic to help out with keeping an eye on any moles. So there's a couple different versions of this out there, but there is the ABCDE mnemonic to help with this diagnosis. So the A is for asymmetry, which is where the two sides of it are not perfectly symmetrical. So if you imagine folding a circle in half, then the two sides are going to look exactly the same. So that is a symmetrical shape. Whereas if you were to fold like a blob in half, like if you were to take paint and splatter it somewhere and then fold one of those splatters in half, that is going to be asymmetrical, so the two sides are not going to look exactly the same. B is for borders. Edges are going to be, again, very, very irregular in shape, so not just slight differences, but very dramatic, obvious differences. C is for color. Again, the color is going to be variation of shades of brown or black within the same lesion. So if you check moles on your own skin right now, they hopefully look the same shade of brown or black across the entire mole, however big it is. If they start changing to where that one mole has a lot of differing colors in it, it's definitely a good idea to go have a doctor check that out. D is for diameter, so these are usually going to be larger than about 6 millimeters, which is almost 1/4 of an inch. E is for evolving, which means the shape is changing steadily over time, which is why it's a good idea to have a good idea of what your moles normally look like, because if they start changing in appearance, that can be an indication of potential issues. Some specialists have some additional letters on the end of it for the most serious form, which is nodular melanoma, and that is E for elevated. It's going to be raised on the skin surface. F is for firm. It's going to feel very, very hard to the touch, whereas normal non-cancerous moles that are not nodule, they're going to be very, very soft and squishy if they are raised. And then G for growing is that it is getting larger consistently. Some other disorders of the skin are eczema and acne. So eczema is an allergic reaction that appears as dry, itchy patches of skin that look kind of like rashes. Another name for eczema is atopic dermatitis. So that's just another way of saying eczema. A lot of people from eczema have an allergy against dust mites, but that's a link that has not been proven, so that's not a hard and fast rule. Lots of different possible reasons of eczema, but we're really not sure ultimately. This is more of an annoyance than anything else, because we get these dry, itchy patches of skin that can make us more prone to infections and stuff like that, which can be dangerous, but usually if caught and treated early on, there's no issues. So treatments are usually going to be moisturizers, really good unfragranced, safe moisturizers, safe for sensitive skin, corticosteroid creams, hydrocortisone, anti-itch creams, and then sometimes immunosuppressants if it's a severe enough case. Acne is something we are all intimately familiar with, I'm sure, unfortunately. This is usually going to occur most often on areas of the skin that have a lot of sebaceous glands. This is the face and back. This can result from infections by acne-causing bacteria. Propionum bacterium is the most common cause. Staphylococcus is another possible cause, but less common. So this is the infection happening, and it's going to end up blocking the duct for getting that oil out and for other substances to get out of that hair follicle, which is going to block it and start forming an actual pimple or blackhead. Is we're really blocking the exiting of those materials from underneath the skin. There can be other causes of this, like certain hormones. That's most common in people who have XX chromosomes and are going to produce a lot more estrogen and progesterone. So fluctuations in those can trigger a lot of issues with acne flare-ups. And then any overproduction of that sebum can also block those hair follicles. Some people genetically just produce a lot more sebum than others, which is a blessing and a curse. It does cause a lot more acne, but it's also going to keep that skin moisturized and in really good condition for a lot longer. And so people who have that excess production of sebum are, yes, likely to have a lot more acne, but they are also far less likely to get wrinkles earlier on in life, and to start that aging process and kind of show that aging process earlier. So blessing and a curse there. So acne, we're all familiar with that. If that's a concern, definitely talk to your doctor. There's some great treatment options out there that you can get either over the counter or through prescription, depending on the severity of your case. So this is what eczema can look like. What's pictured here is a pretty severe case, a pretty bad flare-up all over the forearms and palms of the hand and stuff like that. So this is going to be really uncomfortable, and if it's not treated, then it can lead to a lot of infections. But generally speaking, this is going to get caught really, really quickly because it's so uncomfortable, and we're going to treat that. And then this is just that graphic of what acne is doing underneath the surface of the skin. So we get that plugged follicle from that accumulation of keratin and sebum, and it's going to keep accumulating, start causing some mild inflammation. The bacteria are going to start growing there, and then we're getting a lot more of that inflammation and some evidence on the surface of the skin that is actually happening. And then we're going to talk about some injuries of the skin. So burns are the biggest injury that our skin is going to have the most issues with. There's obviously other injuries like cuts and scrapes, but usually those, if they're not too bad, are going to heal up just fine on their own without any or very little medical intervention. Burns are a little bit different. So burns can be caused by a variety of different things, a lot of heat, radiation, electricity, and chemicals. This is going to cause skin cells to die and can also lead to a huge loss of fluids in the body, which is throwing off that homeostasis that we're trying to maintain constantly. And so burn patients, more severe burns, are going to be immediately treated with IV fluids to help offset that dehydration. And that can also enable the doctors to provide nutrients through that IV placement to help increase their chances of survival. So burns are categorized into groups based on how deep of the skin is being affected. So first degree burns, these are very superficial that are only going to affect the epidermis. So most of us have gotten a first degree burn at some point in our life. For a variety of reasons. Sunburns, minor sunburns are going to be first degree burns. If you accidentally touch a hot pan or something, that's usually going to be a first degree burn because normally you're going to touch it and then immediately let go, and so it's not, that damage is not lasting. And so that's usually going to stay to a first degree burn. Second degree burns are going to affect both epidermis and the upper portions of the dermis. This is where we're going to start seeing some blistering and a bit more swelling and stuff like that. This is where we really want to start keeping those burn sites clean and as sterile as possible to prevent infections. These burns can take several weeks to heal. Third degree burns are going to extend fully through the epidermis and dermis, destroying all of that tissue and even affecting nerve endings and sensory functions of our skin. So this is a really, really bad burn. These burns can actually appear white, red, or black, and these absolutely require medical attention ASAP. If you get a third degree burn, you need to go see a doctor immediately. This is ER level type of burns. You need to go to the ER if you get these types of burns. They are going to heal very, very, very slowly. The risk of infection is super, super high here. The risk of dehydration is incredibly high here because we have damaged so much of that skin. Fourth degree burns are the worst. These are going to affect not just the skin, but the underlying muscle and potentially bone. These obviously are going to require medical attention, and even then, survival is not guaranteed, unfortunately. Interestingly, but also it makes a lot of sense based on what structures are being damaged. 3rd and 4th degree burns are usually going to be the least painful because we've destroyed those nerve endings in the skin, and so there are no nerves to sense that pain or anything like that any longer. So if you get a bad burn and you can't really feel it, definitely go get medical help. Obviously, if it's a very, very small area that's been affected, then it's the healing process is going to go a lot faster and not be as bad. But frequently, if people are getting 3rd and 4th degree burns, they have been exposed to a lot of damage, and these are usually going to be burns that we're seeing across pretty large areas of the body, which again is going to throw off that homeostasis. We're losing tons and tons of fluid, and so those are usually going to be very, very serious. Full thickness burns, these 4th degree burns, the body really, really struggles to repair because we've destroyed all of those local tissues that we would normally use to regenerate and repair. And so once we kill those off, we don't really have those anymore to fall back on. So these really, really require that medical intervention to start repairing that damage. Sometimes we need to remove some tissue. That's called debridement, amputation in severe cases, and then this is usually where we're going to start seeing skin grafts come in, from some method. This can be taken from other areas of the body or grown in a tissue culture, but we really need to seal up that wound as quickly as possible. Other injuries to the skin include scars, so even minor injuries, cuts and scrapes, are going to potentially produce that collagen-rich skin formed after the wound heals. Keloids are raised or hypertrophic scars. Some people get keloids from piercings. A lot of people get bumps from piercings. Most of those are not keloids, though. It's actually a very small percentage of the population that is susceptible to keloids, but there are those people out there. Much more commonly, piercing bumps are going to be some sort of granulation tissue where the skin is just overproducing a lot of that wound healing tissue, that granulation that we talked about with the tissues lecture in week 3. Bed sores and stretch marks are other possible injuries. Bed sores are very, very common in elderly people and very, very disabled people who are bedridden. These are sores on the skin that are going to develop because they're not getting enough air supply. There's a lot of pressure put on them, which is cutting off blood supply and stuff like that. So the skin will actually start breaking down, and then if they're not treated quickly enough, then the underlying muscle and bone tissue will start breaking down as well. These can also be called decubitus ulcers. Bed sores are much more common, so again, they're very commonly in elderly patients and other people who have debilitating conditions causing them to be immobile in some way or bedridden. So it's generally really good practice in hospitals and long-term care facilities to turn the patients every few hours and keep that skin from having that constant pressure for too long, cutting off that blood supply. So moving those people as regularly as possible is really, really good practice. If people are getting bed sores, then that can be a really good indication that they are not getting the care that they need. Stretch marks, this happens when the dermis is stretched beyond the limits of its elasticity. There are a lot of elastic fibers in it, but even that has its limits. These are not life-threatening. They're usually not going to cause any issues other than some cosmetic appearance that most people do not like, even though this is a very, very, very common. Everybody has stretch marks because we all grow from infancy. Think about how small a newborn baby is and how large of a person you are now. That is going to cause your dermis to stretch. It is a fact of life. There is nothing wrong with stretch marks. And then calluses are thickened areas of skin that come from constant abrasion, so constant, not pressure, but kind of movement against a certain area. So gymnasts tend to have calluses because they are constantly having that rubbing on the skin from the bars and stuff like that. But calluses, again, are something that are usually going to just be uncomfortable. They're not usually going to cause any further issues. Calluses can be really, really small. But those basal stem cells are triggered to divide a lot more often, which causes that thickened area of that particular skin to try to protect the body from further damage. So this is where the skin is reacting to this problem independently from the rest of the body, which is kind of cool. Corns are special types of calluses that form from the abrasions on the skin that result from an elliptical type motion, so some sort of circular oval shaped motion. And that wraps up our integumentary system.